We welcome you. Thank you for being here. A lot of interest apparently in some bills today. I bet it's not the first one. It must be the second and third one. But we're thankful you're here. Just a little bit of reiteration of kind of how we process things. We certainly have the bill sponsor come present the bill, and then we'll take testimony on the bill. Everything flows through the chairman, questions, et cetera. And then we'll allow questions from the committee members to presenters as well. One thing I would say is because we have an hour and a half approximately to get these bills, the first one I think is going to be very quick. We'll try to get through them in an expeditious way. So if you've heard something before, you don't have to repeat it. Just we'll keep moving through the presenters. So with that, we'll start with our first bill. Thank you very much. Get to my bill and we do have some folks online, but I don't see anybody for this particular bill. They all have to do with 159. So we'll go now. Senator Dockstader, would you like to present Senate File 167, please, sir?
Certainly. Thank you, Mr. Chairman, members of the board. I bring you Senate File 167, Board of Chiropractic Examiners Critical History Records. Mr. Chairman, members of the committee, I'll provide a brief introduction, go over the bill, and then kind of close out. Mr. Chairman, this bill is specific for the purpose of protecting the public as part of their health care needs. On the application for license in the state of Wyoming, it asks about criminal history or convictions. There's currently no way that for the board to verify if someone has a criminal history that would prevent them from getting a license and seeing patients. The board simply has to take a person's word for it. Also, if there's an investigation for a disciplinary action on a licensee, this would allow the board to check and make sure that there are no other criminal issues that would cause a licensee to lose or have suspended a license to practice chiropractic care. As I understand it, our board will be the first to have this verbiage in our state, but it's common in other states for those surrounding us, and I'll have that number here in just a moment. This really is about keeping good players in practice for their chiropractic care, preventing others from that may have lost a license in another state due to a criminal issue to come to our state and try to work their way into the system. We've had a few issues with others over the years, and the chiropractic board simply trying to remedy this issue. With that, Mr. Chairman, I'll briefly go through the bill. Page 1, that allows for background checks, investigations, and disciplinary action. Page 2 provides the information for to the chiropractic board when applying for a license. Page 3 allows for the fingerprinting on request. Page 4 requests information on criminal history, request for fingerprinting again, and allows for the history, and the fingerprinting continues on. And then page 5, the disciplinary action part, and it applies to the initial applicants. And then also on page 5, we promulgate the rules, put in an effective date, and there is no significant revenue impact on this. Mr. Chairman, members of the committee, this simply authorizes the board to have access to the criminal records, allows license applications to be subject to investigations, allows for disciplinary action that comes through the chiropractic board, allows for fingerprinting and the seeking of necessary information on the applicants. And the note on the number of states, 36 states require criminal background checks at this point. And that includes everything from fingerprinting to accessing the criminal records. Thank you, Mr. Chairman.
Thank you, Senator Dockstader. Any questions for Senator Dockstader on the bill? Questions for Senator on the bill? Senator Dockstader, I think in your testimony you suggested that other boards do not have this, and I think actually most other boards do have this authority. Is that, maybe I misunderstood you?
I'll stand for correction, Mr. Chairman.
Thank you. All right. Thank you very much. No questions? Anyone else want to testify to Senate File 167? Yes, please. Introduce yourself and provide your testimony. Thank you for being here.
Mr. Chairman and members of the committee, my name is Emily Krombaugh. I'm the Executive Director for the Board of Chiropractic Examiners. I'm just here if you have any questions of the board.
All right. Any questions for Ms. Krombaugh? Thank you. Thank you. Questions? I guess I do have a question. So you probably oversee some other boards. in your
Mr. Chairman,
capacity, and this board is unique in not having this statutory authority. Is that accurate?
Mr. Chairman, yes, the dental board does not have background check authority either.
Okay. Well, they're not, well, some of them might be here today, but they're not, this is not their bill. It's outside the bill title too, so we won't worry about them. Thank you very much. Any further questions? All right. Anyone else want to testify to this bill? Anyone else want to testify to this bill? Seeing none, no one online for this bill, correct? Okay. Seeing none, committee, what's your pleasure?
I'd move.
There's a motion. We got both ends of the spectrum here. We'll go Senator Crum, you can get the motion on this one. Any discussion on the bill? Any amendments to the bill? Amendments, discussion on the bill? Seeing none, would you call the roll, please, Mr. Caldwell? This is on Senate File 167.
This is a roll call vote for Senate File 167. Senator Crum,
Aye.
Senator Hutchings.
Aye.
Senator Scott.
Aye.
Senator Steinmetz.
Aye.
Chairman
In case
Barlow.
you forgot. Aye.
Mr. Chairman, that is 5 ayes.
Thank you very much. Senate File 167, pass the committee. Senator, we'll see you on the floor. Appreciate your time.
Thank you.
Next bill for our consideration is Senate File 158. Senator Jones is not here. Where's Senator Jones? Go ahead. That's right. So, yeah, she actually did tell me that. She has another bill up. I forgot about that. Yeah. Let's go ahead and do this. Let's go ahead and actually have Mr. Agopian walk through the bill and the folks that brought it. And actually, my name is on this bill as well. So let's go ahead and do that, and then we'll allow some public testimony. And when the good senator gets here, we'll give her an opportunity to speak. So this is on 158. Let's be very specific. We have two different bills before us, but this is on Senate File 158. Mr. Agopian? Yep, thank you.
Mr. Chairman, thank you. Nicholas Agopian, representing the Wyoming Dental Association. I'll let my two folks that are with me introduce themselves as well.
Please proceed.
I'm Dr. Erica Tonso.
Thank you. And who are you with, Dr. Tonso?
I'm the current president for the Wyoming Dental Association.
Thank you.
My name is Leslie Goebbels. I work for Dr. Marsh and Dr. Lucas in Torrington, Wyoming.
And your last name is Marsh? No.
My last name is Goebbels.
Thank you. All right, please proceed as you wish.
Mr. Chairman, thank you. Before you today is Senate File 158, virtual credit cards and network leasing dental services. I might just walk real quickly through the bill, and then I'll let Erica talk more about the need for the bill. Section 1 of the bill speaks and establishes, speaks specifically to network leasing. On page, I would direct your attention to page 2, line 1. There are new definitions that are being created within the insurance code. Definitions for commissioner, contracting entity, covered person, dental care provider, dental care service plan, dental care services, dental carrier, dentist agent, network contract, third party, and virtual credit card. This really just highlights that we've got, I think today, only 2 sentences of statute addressing dental insurance in a regulated market. Page 5, line 5 is where it establishes the 10 elements or the 10 requirements if somebody is going to lease a dental network. And I believe that we're going to hear some amendments from 2 other folks in the room, and I believe that those amendments are consistent with the NCOIL language, and I don't believe we're going to have issues. They help offer some clarification. And then the last part of the bill addresses, starting on page 9, addresses virtual credit cards and the requirements around accepting or opting out of the virtual credit cards. And section 2 has a really important language at the end of the bill, and in that it ensures that existing contracts today are not affected, and it only anticipates contracts going forward after the effective date of July 1, 2025. But the bigger question I think the committee has is how is the lack of regulation for leasing of access to dental networks, and the use of virtual credit cards impacting our small Wyoming businesses, our dental offices across the state. And I'd ask Erica to speak to that.
Thank you, Chairman and Committee, for allowing me to speak.
Please proceed.
My name
Just
is
remind us your name, thank you.
Yes, my name is Dr. Erica Tonso. I am a dentist that has been practicing in Cheyenne for almost 13 years. I am currently the Wyoming Dental Association president. I'm here to testify on behalf of 158. The first part of this bill pertains to network leasing. A practicing dentist makes an educated and informed decision if they want to enter into a contract with an insurance company to become an in-network provider. Items like the fee schedule can be negotiated and agreed upon. As it stands, particularly with smaller insurance companies, they have the ability to lease the pre-negotiated agreement to other preferred provider organization networks where the terms of the agreement can be changed and the fee schedules can be lowered without the consent or knowledge of the dentist. The dentist does not have the ability to consider, negotiate, accept, or reject the terms of the new agreements. Network leasing happens silently. There is no notification to the dentist or the patient. If I have a patient in need of an implant, this is a long and expensive process that can sometimes take a year to finish. During the planning phase, we discuss the process of the procedure, but we also discuss the patient's potential out-of-pocket costs based on the original agreement and pre-negotiated fees. If the patient's insurance company leases the agreement and the fee schedule has changed, the patient could potentially owe more money at the end of treatment. This could be the difference of a few hundred or a few $1,000s. This erodes trust in the dentist and patient relationship. Patients need to be able to trust their dentist is being forthright with information regarding any and all treatment options. If you look at the second part of the bill pertaining to virtual credit cards, insurance companies can determine and limit the method of payment a dentist receives for procedures performed on a patient. The current trend for majority of insurance companies is with virtual credit card payments. While payments are received quicker, each payment comes with a 3 to 5% processing fee. This drops the pre-negotiated fee with those insurance companies even further. The majority of insurance companies have started defaulting to this form of payment. Whether a contract is in place or not, if my office wants to change the method of payment, the insurance companies have not adequately informed us on how to make that change. Sometimes my staff will need to spend up to 5 hours on the phone with multiple people from just one insurance company to change the method of payment. On average, my office makes a request to change the method of payment 3 times a week. This is costing me approximately $350 every week, as well as taking my staff's time away from important tasks that need to be done. Insurance companies also have the right to default back to virtual credit card payments without limitations. Oftentimes, they will default 2 or 3 months later to virtual credit cards, requiring my staff to request a different method of payment yet again. Both aspects of this bill allow for more transparency between insurance and the dentist, creating the opportunity for a dentist to have more accurate information to help educate patients and allow for a more trustworthy relationship. Thank you for listening.
Thank you very much, Doctor. Any questions? Any questions? Senator Crum.
Yes, Mr. Chairman, just a question. When I heard, did I hear you correctly that you have no say with the insurance companies on the form of payment, credit cards or otherwise, and what the fee would be charged on those? Did I hear that correct?
Thank you. Please proceed.
Thank you. Depends on the insurance company. Some will limit the method of payment where the only option is virtual credit card. At that point in time, I am forced into a 3 to 5% fee and requiring my staff to constantly try to get out of it. But if they only allow for virtual credit card processing, then that is the only method I'm allowed to accept. This would open that avenue to allow me to decide personally if I want to take that 3 to 5% fee or choose to go with a check or different method of payment.
Thank you.
So just for the committee's edification, that is page 9, 1 through 3, where it has that prohibition on solely the virtual credit card payment process. So, all right. Thank you very much. Further questions? Thank you. Senator Jones, welcome. I know you've got a busy afternoon. Maybe we'll continue with testimony for a little bit. These are your folks that, and Nick kind of Mr. Agopian gave the opening remarks. We'll go through that and then you can kind of wrap it up, if that'll work for you. All right, let's just go down the line here. Go ahead. And who else wants to testify to this bill? I've got some agency folks here. I've got the Department of Insurance, A&I. No agency folks want to testify? Anybody else wants to? Come on up if you want to testify. Fill the open seats and go ahead with your testimony. I don't think we'll need you anymore, Doctor.
Yeah.
Thank you for being here.
Thank you.
Thank
ahead,
you,
ma'am.
Mr. Chairman. I am strictly here to answer any questions that the committee may have on how this all works. Insurance companies sometimes have a tendency to make things a little confusing. So if you have any questions, I'm here to answer.
Okay, thank you. Questions? All right. Remind us who you're with. You were with some dentist somewhere, right?
Yes, Dr. Britton Marsh and Dr. Lance Lucas in Torrington, Wyoming.
Torrington. Thank you very much. I don't see any questions for you, so you're off the hook. All right, please proceed. Catherine, Ms. Wilkinson?
Good afternoon, Mr. Chairman, members of the committee. Catherine Wilkinson here on behalf of Delta Dental Association or Insurance Group.
Mr. Chairman, I'm Patty Guzman. I'm the Vice President at Delta Dental of Wyoming. Mr. Chairman, Delta Dental just wanted to stand up and in support of this bill. Delta Dental of Wyoming does not use virtual credit cards. We do not do network leasing, and so we just wanted to stand up in support of the bill. It is not applicable
It's
to
not
us, Mr.
applicable to you,
Chairman.
therefore, it's not a worry, okay? Anyone else want to testify to this bill? Come on up, Senator Jones. Sorry, we shouldn't have sent you, I didn't mean to send you away. I apologize. Anyone else want to testify to this bill? Come on up. Sorry, they didn't jump up fast enough. I thought we were done, so. Go ahead, please identify yourselves and provide your testimony. We'll go with our we're going to skip Senator Jones again. So I apologize, Senator Jones. Go ahead.
Good morning, Mr. Chairman. Raymond Redd, Blue Cross Blue Shield of Wyoming.
Go ahead.
I can talk loud enough. Good afternoon, Mr. Chairman, members of the committee. My name is Kelsey Prestasater, and I'm also with Blue Cross Blue Shield of Wyoming.
Thank you. Go ahead and proceed with any testimony.
Similarly to Delta Dental, Blue Cross Blue Shield of Wyoming does not have any issues with this bill, apart from the addition of affiliate language that we'd like to propose as an amendment. These amendments they're consistent with the National Council of Insurance Legislators, otherwise known as NCOIL, with their model language adopted in 2020. And this was the result of significant negotiation and agreement between the American Dental Association and the National Association of Dental Plans. And similarly, Mr. Agopian also testified today that the Wyoming Dental Association would be amenable to this amendment. So the proposed amendment would be on page 8 from lines 12 to 17 to delete that language entirely and instead insert replacement language from the NCOIL model that includes affiliates as well as licensees in the exemption from this language.
Thank you. So we've got a lot of papers up here, so I want to get my committee all on the same one. I believe this actually says Blue Cross Blue Shield of Wyoming on the top of it. Is that accurate?
Chairman, yes, it does.
Okay. Amendment number 1, addition of affiliate language is the title on this as well. Does everybody have the right language? Senator Scott? Senator Crum? Senator Crum, this is what it looks like. I'll pass it to you.
Oh, that is big. Hang on, I don't have it.
Actually, this might be labeled incorrectly. This says Senate File 159. Is this for 159 or 158?
It does, it is, there is a typo on the beginning, I apologize, Chairman, but this is for the network leasing and virtual credit card bill.
Okay, so this is, so it
158.
should be 158. So just to confirm, this one should be 158 on it. Is that accurate?
Yes, that is correct.
All right, thank you, Kelsey. All right. All right, questions on the amendment that's before us? Senator Hutchings.
Thank you, Mr. Chairman. I just wondered what Senator Jones thought about this amendment.
Yeah, you have any questions on the
Thank you,
amendment for these
sir.
folks? I just want to clarify, because we were kind of looking for the correct amendment. This is consistent with what the presenters talked about, the National Council of Insurance Legislators, and they have a document that's also accompanying the materials. So this is something that there's maybe a national standard, if you will, that legislatures are looking at. Go ahead, Senator Hutchings.
And thank you, Mr. Chairman. Kelly did mention
Kelsey.
page 8, but I think she meant 5, 11 through 17. Oh, goodness gracious.
So I don't have the thing with me.
Yeah, we have a lot of papers, I
Yeah.
apologize. Mr. Red, go ahead. Or somebody, if somebody else wants to respond.
But she said insurance leasing, so, all right,
Yeah.
okay.
All
Let's
right,
figure
I think
this
we're in
out.
good shape.
Let's do
We're in
it.
good shape, Kelsey, don't worry. We're in good shape.
No, that's
We're in
okay.
good shape. All right, so we have an amendment for us. Any questions on the amendment? Don't see any?
I just
Senator
wanted
Hutchins.
Senator Jones's comment on
Yep,
the amendment.
Senator Jones,
Thank
do you have, is there any other amendments or any other testimony on this bill? So we're in good shape. Thank you for providing us
She didn't
that.
have
Thank
any?
you. Senator Jones, any comments on you want to give us anything on the bill and on the amendment? Please proceed on Senate File 158.
Mr. Chairman, Senator Hutchings, yes, we are in agreement with the amendment. I think the amendment is agreeable to everyone.
Okay. Excellent.
So just to be clear, not only the number is incorrect, but the title of the bill is incorrect on this
Yeah.
amendment, just so we're good. It's all right, there's two bills, they're numbered sequentially. Senator Scott,
Mr. Chairman,
this is a different amendment, Senator Scott.
this one,
This one, Senator Scott.
I do not seem to have.
I won't dig through your stuff, but there's mine. Senator Crum, we'll go to Senator Crum while Senator Scott reviews that amendment.
Mr. Chairman,
You're not on the right one either.
I've got the right one right here. Okay, so my question is, we've got, looks like two amendments are gonna be proposed, the one we're talking about. And then there's another one coming up that addresses the same, or it looks like similar language, maybe it's not. One's page 8, one's page 5, so I guess I'm confusing myself, so.
Yeah, let's just stick
Okay,
with the one
go
we have
page
before us.
8, okay, got it.
Stick with one before us. All right. Any
That's crazy.
questions? Nope. Senator Jones, anything to add to this amendment? It's agreeable.
Sounds like it was all taken care of ahead of me before I got here. I apologize for
No, that's
being
okay.
late.
158, we have an amendment from Blue Cross Blue Shield. Thank you very much.
Thank you.
Anything else from the members or from the public? Do we have anybody for this bill online? Okay. This is for 158 from Buffalo, Wyoming. Are you available? Haskell?
Yeah, I think they, yeah.
Go ahead and introduce yourself, please.
I'm Dr. Thales Haskell up here in Buffalo, Wyoming. I'm the president, director of the Northeast District of the Dental Association.
Perfect. Go ahead and provide any testimony if you have anything specific.
Yeah, I agree with what this is. The umbrella plans that are out there in the insurance industry do these things without the dentist's knowledge or anything like that. The only option that a dentist essentially has with these network leasing is to drop the plan, which hurts the patients and everything else. As to the virtual credit cards, I'm in agreement with what they have going on right now. the dental industry as well, the insurance industry, when they send you those virtual credit cards, they, once you process those, it automatically re-enrolls you in the virtual credit card system, which costs, again, like Dr. Tonso said, it was 3 to 5%. And as a small business owner, every percentage counts. So I'm in agreement with that as well.
Thank you very much. Any questions for Dr. Haskell? Any questions? Seeing none, thank you for being with us. Actually, I have a Melissa Young that has 158 noted as well. Is Melissa Young on? Does she want to give any comments on 158? All right. Ms. Young, if you'd like to provide any comments, go ahead and unmute yourself, and camera, if you so choose, provide your testimony.
Good afternoon, Mr. Chair and members of the committee. My name is Melissa Young, and I'm the Regional Vice President for Wyoming for the American Council of Life Insurers. I appreciate the opportunity to testify this afternoon on Senate File 158. ACLI requests an amendment which relates to clarifying the requirements for fairness and transparency in network contracting for dental services by carriers offering standalone dental plans. We respectfully request that Senate File 158 be amended to align with the National Conference of Insurance Legislators, or NCOIL's Transparency in Dental Benefits Contracting Model Act, adopted in 2020, which the representative from Blue Cross Blue Shield just mentioned. The model, which includes network leasing, was negotiated at NCOIL to improve transparency and ensure communication between providers and carriers, including requirements for provider notification. As drafted, Senate File 158 deviates slightly from the NCOIL model, and this deviation is likely to cause confusion. So I do believe you have an amendment in front of you on page 5, lines 11 to 17. As the bill is written, it's unclear as to whether providers must have an opportunity to opt out or opt in to third-party network access. The Model Act language contains a clear. So we just suggest and respectfully request that amendment also be adopted. Thank you, and I'm happy to answer any questions.
Thank you very much. We do have the amendment for us in a written form. We appreciate that very much. Questions? Questions? Please go ahead. Senator Hutchings for Ms. Young.
Just wondering what Senator Jones thinks about this amendment.
Thank you. Senator Jones, have you reviewed this amendment? Do you have any suggestions or thoughts?
Nope, this amendment is fine with me as well.
All right. Senator Scott?
Mr. Chairman, on this amendment, it appears to me that it's written such that the dental carrier has to object at the time the network is entered into or renewed, and the dental carrier, the dentist may not know at that time that all the evils that particular carrier is going to impose. And I think this amendment, Mr. Chairman, will tend to gut the bill.
Well, I don't know, we should preclude that everything they do is evil, but there may be concerns in the process. So thank you, Senator Scott, for those concerns. We'll take it up when we take up the bill and work the bill. Further testimony on the bill. Further testimony on the bill. Thanks, Ms. Young. Further testimony on the bill. Further testimony. All right, Senator Jones, if you'd like to do anything with this bill, walk us through the bill, anything, it's at your floor now. We've taken testimony. We've got a couple of proposed amendments. Like I said, you don't have to do a thing. We can just work it and go from there. It's up to you.
I'm assuming that they've probably already gone through the ins and outs of this bill, so I'll just defer to the committee.
Yeah, I think we've got an understanding of generally what it does, not maybe a deep dive, but I think we have a general. Does anybody have any questions for Senator Jones? Questions for Senator Jones? Seeing none. All right, no further testimony. Gone. What's your pleasure on Senate File 158? There's a motion by Senator Hutchings on the bill. All right, let's just walk through the bill. You have two amendments before you that have been suggested, but anything on page 1, 2, 3, 4, page 5. This is where there was a suggested amendment from folks. Do we want to take that up? Senator Scott voiced some reservations about it.
Mr. Chairman?
Go ahead, Senator
Just
Trump.
to help avoid maybe some confusion, can we call this amendment number 1?
We can
Just
do
for this
that.
conversation, and then the other one would be.
We
amendment
will
number
number
2.
the amendments.
Would that be okay?
That'd be great.
Okay.
Golly, he must be a banker.
I would tend to agree with Senator Scott on this amendment.
Mr. Chairman,
Go ahead, Senator. All right, so I think when we come into this kind of thing, this will allow the bringer of the bill and the industry to work together a little bit, understand, and then maybe something comes to the floor that's makes better sense or different sense or whatever. So no action on this amendment. Where the heck did Senator Jones go? She just disappeared. Oh, she's hiding in the second row. All right. Any further discussion on page 6, 7, 8? Page 8. We have another suggested amendment on page 8. This is amendment number 2 from Blue Cross Blue Shield. So there's a motion on this amendment to do as it says. Did you get a copy of this one as well? Yes. Okay. Steinmetz moved this one. Discussion on this amendment? Discussion on the amendment. Senator Scott.
Mr. Chairman, I think this amendment works.
All right. Further discussion? Seeing none, all those in favor of amendment number 2, which is the Blue Cross Blue Shield proposed amendment, all those in favor say aye.
Aye.
Those opposed, no. The amendment is adopted, and Clayton has a good copy of it to send to our staff. Further amendments, page 8, the rest of 8, 9, page 10.
Mr. Chairman,
Senator Scott.
Mr. Chairman, page 2.
Oh, page 2? All right, we're going back to page 2.
Lines 3 and 4. And I'm looking at the insurance commissioner. I think throughout, this is in Title 26. I think, and throughout 26, commissioner means the insurance commissioner.
Mr. Root, if you'd like to come up, what I think Senator Scott is trying to say is we probably don't need this definition.
Yeah.
Because it is in Title 26, and if it's referenced elsewhere earlier in the statute, or the title, we may not need it. So Commissioner Rood, welcome. Introduce
Chairman.
yourself and give us any thoughts on that.
Jeff Rood, the Department of Insurance Commissioner. Senator Scott is accurate. It's not necessary.
Okay. So I think Senator Scott moved to strike lines 3 and 4. Is that accurate, Senator Scott? All right, discussion on it? Seeing, Senator Scott?
Mr. Chairman, just doing away with a little sloppy drafting.
1, 2, 3, 4, 5 words. Save 5 words. Discussion, seeing none, all those in favor, say aye. Aye. Those opposed, no. Amendment is adopted. We're good on that one, Clayton? Okay. Any other amendments in the bill? Amendments to the bill? Seeing none. Senator Jones, we'll let you take up that first one, make sure it fits in, and maybe visit with Senator Scott about it a little bit if you so choose. Further discussion, seeing none, please take a roll call on Senate File 158.
This is a roll call vote for Senate File 58 as amended. Senator Trump.
Aye.
Senator Hutchings. Aye. Senator Scott.
Aye.
Senator Steinmetz.
Aye.
Chairman Barlow.
Aye.
Mr. Chairman, that is 5 ayes.
Thank you very much. All right, now we'll get this in the right order. Senator Jones, would you like to present 159? And if
Mr. Chairman, would you like
if Nick
to
or any of the other
begin?
folks want to come up, you just bring them up and we'll let Senator Jones kick it off and then she can hand it off. How many folks are going to want to testify on this one? 1, 2, 3, 4, 5, 6. All right. As again, we've got 45 minutes left. So we're going to be timely about this, and we're going to get this through this bill today. So go ahead. Senator Jones, go ahead. We're on
Mr. Chairman.
159.
This bill is being brought by our Wyoming dentists. These dentists are small business owners, and they are integral parts of small communities throughout Wyoming. This bill is hoping to establish transparency standards for the insurance review practices of downcoding and bundling claims, and to ensure dentists can receive payments at the in-network rates for the services performed. This bill amends Article 5 of Chapter 22, the hospital or medical service insurance and title insurance within the insurance code in Title 26. So to make a few things clear, definition of downcoding is the adjustment of a claim submitted to a dental health benefit plan to a less complex or lower cost procedure code. When a dentist submits a claim for a specific procedure, the insurance company may change the code to one representing a more straightforward or cheaper procedure, potentially reducing the reimbursement. For bundling, the definition of bundling is the practice of combining distinct dental procedures into one procedure for billing purposes. This means multiple separate dental procedures are grouped and billed as single procedures. The bill has 4 sections, and Section 1 starts with new policy language on downcoding, establishing limitations for insurance providers who employ the practice of downcoding claims to ensure dentists receive full payment at in-network rates for services performed. Continuing on, we're on page 2, sorry, I should have said that. The new policy language on bundling establishes limitations on bundling that prevents payment for services performed under generally accepted billing procedures. And it also establishes 3 requirements for downcoding. Consistent with the patient's policy, the reviewer has sufficient information, and the EOB provides an explanation and references to the policy. In this section, it also specifies the limits of the EOB, including subjective or disparaging remarks on the EOB. It also specifies additional limitations on the wording of an EOB. It requires the insurance provider to disclose specific downcoding policies the provider generally applies during this review. This is a significant component of this bill, as it provides transparency that the dentists are seeking. This is the information needed to inform our patients about the potential costs of the procedure. Page 3 just goes over the definitions that I've already described to you. Onto page 5, it talks about the dentist's direction for collecting fees for services performed that have been downcoded if the patient provides informed written consent. It also repeals 26-22-505C. Section 3 is enabling language addressing contracts signed before the effective date. So anything July 2025, that was hard for me to say, sorry. July 1st of 2025 are not affected or subject to the provisions. And then Section 4 just applies July 1st, 2025 for the effective date.
Thank you, Senator Jones. Could you just for we're clear, what's 505C? I didn't look it up before I came down. What's the repealer? Somebody can get to it when they come up, but let's get to the repealer when we can. Questions for Senator Jones? Questions for Senator
Yes.
Jones? Senator Hutchings.
Thank you, Mr. Chairman. Senator Jones, you've referenced Echo Oscar Bravo several times, and I don't see that anywhere. Can you define that for me, what
Senator Jones.
EOB is?
It's explanation of benefits.
Sorry, yes,
right?
explanation of
Go ahead.
benefits. I'm
Okay,
sorry, I
my
should
bad.
have said that.
All right, further questions for Senator Jones? All right, thank you. Dr. Kotan, go ahead and introduce yourself and provide your testimony. Thank you for being here.
Thank you, Mr. Chairman, members of the committee. Thank you for allowing me to speak today. We are here, or I am here, to speak on behalf of our patients.
Go ahead and introduce yourself.
I'm
So-
sorry.
Yourself on the record for everybody, because there's folks online. I know you, and where you're from, please, and your business.
Dr. Brian Cotant from Buffalo, Wyoming. I've come here to speak on behalf of our patients and your constituents. I come to you today to ask for a yes vote on Bill SF 159 to help protect all Wyoming citizens that have insurance from predatory practices that the dental insurance companies continue to try to implement to cut patient quality of care and doctor-patient relationships to increase their bottom line. This bill will hold them accountable to us as patients and providers with transparency on explanation of benefits and stop them from hijacking our ability as patients and providers to seek and provide the quality of dental care that patients choose. Saying no to this bill is to increase profits for their shareholders and corporate officers. This is unfortunately a trend that we are seeing across all areas of healthcare and must be stopped. We have a lot of examples and reasons that we will submit to you for your inspection to prove precisely what the dental insurance companies do to us as providers on a daily basis. Some examples are simple, routine care visits that get coded and bundled, all the way to extensive treatment performed by, highly trained, highly educated providers who perform them to only be downcoded by someone or a computer program, neither of which have gone to dental school, I might add, to what insurance companies feel should be included in a particular procedure they were not even in the room for, nor do they care, as they are following some highly shrouded in secrecy formula of how a procedure should be performed to lessen the benefit amount to the patient and provider. We as dentists are held to a legal and ethical standard of care and coding, and they, insurance companies, can pay claims as they choose. They will bundle codes to pay that particular visit at a lesser benefit, impacting future care, which only benefits the insurance company's bottom line, not the patient nor the provider. Insurance companies don't want lay people to know that there is a maximum benefit that has not been increased in decades. Regardless of how much the annual premium paid for by the employer or the patient has increased, that insurance company will pay out annually as long as all of the ridiculous red tape, bureaucratic loopholes and hoops have been jumped through, regardless of what or how many procedures the patient may need or want. In fact, according to the ADA, only about 6 to 8% of patients with dental insurance will use their full benefit, maximum benefit each year. They claim that allowing dentists to charge separately for each procedure will lead to a quicker depletion of benefits and higher patient and employer expenses. This couldn't be further from the truth. Legally, as providers, we have to bill out each procedure we do separately. The insurance companies then arbitrarily choose how they want to pay said visit. Who gave them the power to careen down the path of lower quality care and materials with fewer and fewer participating in-network providers? We did. As providers, slowly for years now, we have quietly given these insurance companies more and more power over our care for patients by inadvertently or advertently complying with all of the things that we have to do to help our patients get the benefits that the insurance companies have promised them at a cost to the dentist, all to help out our patients, again, get the benefits from the insurance company that has either been paid for by the patients directly to the insurance company as an individual plan or supplied by the employer as an employee benefit. I would bet that if employers simply gave each employee an annual dental care benefit each year that matches the amount paid currently by insurance companies as yearly maximum benefit, it would save employers an exponential amount of money that is merely lining the pockets of shareholders and corporate officers. Due to the complexity of dealing with insurance companies, many dental offices now have to employ another person solely to communicate with insurance companies, whether they are in-network or out-of-network providers. And you heard that with Dr. Tomza's testimony as well. I know the ladies in my office average at least 2 hours, if not 4 hours, on the phone with insurance companies each day. The hours spent on hold waiting to speak to a live person or getting someone who can actually help you is a complete waste of time and money. I'm sure most of you can relate on how frustrating it is to be on hold for ridiculous amounts of time. Insurance companies are in the business of denying claims and not paying them. It cuts into their profits. This is their business model, or why else would they be in business if it wasn't to make money? If they can keep providers and patients confused with misleading information, bundling codes, denying procedures, downcoding, and constant requests for additional information that was usually sent initially but somehow gets lost in processing, they can continue to erode the trust between a patient and their healthcare provider. We ask that you vote yes to Senate File 159 to put patients' care back into patients' hands and out of the corporate bottom lines. Thank you for your time.
Thank you. Questions for Dr. Kotan? Questions from the committee? All right, thank you. Go ahead, if you'd like to provide some testimony on Senate File 159.
Thank you, Mr. Chairman. Again, I'm here for any questions. I am one of those people that sits on the phone for hours each day when I could be helping patients directly. I'm unfortunately on hold. So speaking as the person that has to go through all of this every day, I definitely support this and would appreciate your support as well. Thank you.
Thank you. So two different offices here. So give me an estimation. I know your business partners or your business managers here. Give me an estimation of how many of the procedures, invoices, whatever, actually might have this occur to them. Is it 100%? Is it 50% that either have down coding or bundling, or I even heard the combination of the two? So what percentage of the procedures or patients, or however you want to characterize it, would you say you have to deal with this particular issue, these two issues, down coding and bundling, on a daily, weekly, whatever basis? Thank you. Either one of you, go ahead.
I think you have.
I would say close to 75 to 80% of all claims that we deal with in my office are either downcoded or they are bundled into, as far as x-rays are concerned, for routine visits.
Okay, thank you. Dr. Kotan, anything out of your office, or?
I would say similar. Thank you, Mr. Chairman. I would say similar. I know I have a great team up front and who allows me to do my work. I know some smaller offices. The doctor does do a lot of the work and isn't able to hire that person to do their insurance. And so that keeps them away from patient care, unfortunately, and doing the claims on their own. So I would defer to Leslie's answer. I would say it's similar.
Okay, thank you very much. Senator Scott, did you have a question?
Yeah, Dr. Kotan, is it?
Kotan.
Kotan. Do you not understand that one of the ways that an insurance company has to make money is by not paying the claims?
I think that might have been rhetorical, because I think that was your testimony. Thank you.
Thank you,
Senator
Mr.
Scott.
Chairman.
Any questions for the panel? Questions for the panel? All right, thank you very much. Thank you for being here.
Thanks,
Thank
Senator.
you. Who else wants
Thank you,
to,
Chairman.
let's get the actually commissioner up first and A and I. Maybe Senator Jones, if you don't mind, don't hide, just find a spot. We'll get some of the agencies up here on this one, because they nodded that they were interested. A and I, if you want to testify, you come on up. We'll start with Commissioner Rood. Please introduce yourself and provide testimony.
Mr. Chairman, I'll be brief. It's Jeff Root, Insurance Commissioner. We're neutral on the bill. We had actually talked with both sides throughout this process, and we raised a question with both sides. And the way we read the bill, it appeared to us that we might have more consumer complaints.
Say that again, please.
Okay, we spoke with both sides on the bill, on each side of it, and to us, it read as though there might be an increase in consumer complaints if consumers now receive bills directly from their dentist versus things in the past that might have been just handled by insurance. And, and so we checked with other states that have passed this, and that was confirmed, that they do receive significant more complaints when they receive a bill from a dentist. They call the office, and then it's explained that the dentist can do this. They have services, some are covered, some are not, and things are fine. And I just wanted to pass that on as a data point. It's something that we thought we would see in the future. The only other point we were going to make was on page 2, lines 17 and 18, there's a phrase that says, under generally accepted practice standards. And we talked to 2 other states, and interesting enough, they said they get complaints by both the dentists and the dental insurance companies. The dental insurance companies thinks it's their standards, while the dentists think it's their standards. And the Department of Insurance is not really sure how to, I don't think they're actually entertaining those complaints because they're not sure how it stands. It just comes down to where you stand is how you view things. And there might be different standards of the 2 entities. So those were the only 2 comments I have. I understand there's going to be an amendment to the bill that might clean up that language or at least take it out. And so maybe it won't be an issue. You had asked what the repealer language was, Mr. Chairman. So I pulled the statute, and there's not much in our statute on dentistry, and it's referring to, it says, this section shall not apply to contracts, policies, or certificates issued, renewed, delivered, or issued for delivery in this state on or after 1 July 2001. So a prior section was put in. This is just updating that. I don't think there's any problem with getting rid of that. So.
Okay. Thank you very much. I
So
appreciate
and with
it.
that, I'll stand for questions or stand
Questions
by.
for the commissioner? Questions? Seeing none, thank you. Please.
Thank you, Chairman Barlow, members of the committee. My name is Erin Williams. I'm the Human Resources Administrator for the state of Wyoming. ANI remains neutral on the bill as well. Our main reason for coming before you today is I would like to introduce you to Karen Williams. She is the new Administrator or Program Manager of Employees Group Insurance. She has been in the position since July. She has taken over for the previous Program Manager, Ralph Hayes. Karen has 22 years of experience in the Employees Group Insurance. And at this point, I would just turn it over to Karen for a few brief remarks from Employees Group Insurance.
Thank you. Welcome aboard. Ms. Williams, Ms. Williams. I think I caught
Chairman
that
Barlow,
correctly. Go
committee.
ahead, please.
Glad to be here. You stole my thunder. I have been in group insurance for 22 years, and while that's not something folks want to grow up and be in insurance, it's something I take pleasure in. We are neutral on the bill as far as employees group insurance is concerned. This is something that will likely shift cost to members as things currently function. Our overarching objective is to make sure that we provide broad but comprehensive benefits at an affordable cost. So if there's cost shifted to the patients, to the members, the employees, that is going to shift to the member. If down the road something happens and then we're required to pay for that, that will then impact premiums. So as far as a risk or just consequence down the road, that's what we could see might happen, but are completely neutral on the bill. So I just stand for questions.
Thank you. Questions? Go ahead for Ms. Williams, the new administrator.
Yes. Mr. Chairman, question would be, as I'm looking at this bill, if I get it right, if it passes, then the cost kind of shifts over to the patients.
Mm-hmm.
If it doesn't pass, then the cost is going to shift over to the insurance premiums are going to go up. It sounds like to me that it's premium, the patient's going to pay more one way or the other, whether they pay it direct or they pay it through increased premiums. Am I reading this wrong, just knowing economics, nothing's for free?
Chairman Barlow, Senator Crum, absolutely. It's got to be paid for one way or the other. So the member's going to pay it based on the way the contracts are set with providers, dentists, and the dental carrier and the agreed upon rates. And so if the contract is in place and the insurance company is not required to pay it, the member will pay it. If ever we're required to pay it, the premium will go up. We'll be impacted. So.
Okay, thank you. Further questions? Welcome aboard, Ms. Williams.
Thank you.
Look forward to you. Thank you for being here, Aaron.
Thank you.
All right. Thank you. Any other agencies? Any other agencies? All right, who else would like to testify on the bill? I have a couple of people online. We'll get to you in a little bit. Go ahead, Ms. Wilkinson. And whoever you want to bring. Looks like Delta Dental is coming to the forefront.
Mr. Chairman, members of the committee, again, Catherine Wilkinson here today on behalf of Delta Dental of Wyoming. I'll let my colleagues introduce themselves as well.
Go ahead.
Oh, there we go. Thank you very much. My name is Kerry Hall. I'm the president and CEO of Delta Dental of Wyoming.
Hall, H-A-L-L?
H-A-L-L.
Thank you, sir.
And Mr. Chairman, again, I'm Patty Guzman, the Vice President at Delta Dental of Wyoming.
All right, please proceed.
Mr. Chairman, we do have some brief comments on the bill, and then we have some proposed amendments, as well as a handout for financials if you are interested in seeing the financial impact to Delta Dental should this bill go forward. If that would please the committee, if we could proceed in that order.
Yeah, go ahead with your general comments if you want, and then if you're going to refer to any particular document, show us which one it is, because like I said, we got a pile of them up here. So go ahead, Ms. Wilkinson, thank you.
Okay,
I'm sorry, Mr. Hall, go ahead.
Thank you. Good afternoon, Mr. Chairman and committee members. My name is Kerry Hall. I'm the president and CEO of Delta Dental of Wyoming. We feel this bill will only benefit dentists at the expense of Wyoming employers and citizens. Delta Dental of Wyoming provides coverage to over 1,000 employers in Wyoming, including the state of Wyoming, and over 6,200 individuals and families that have purchased a plan with us. That translates into over 100,000 lives across Wyoming. If passed, this bill will enable dentists to separately charge patients for services that are normally part of a procedure. It will leave Wyomingites vulnerable to fraud and/or inaccurate charges by removing the ability of an insurer to correct code services when billed incorrectly, and will remove contractual provisions designed to make dental care more affordable for patients and Wyoming employers. Oral health is a big part of one's overall health, and this bill will significantly impact Wyomingites' ability to receive and pay for dental care in Wyoming. We urge you to vote no on this bill, and thank you.
Thank you. Go ahead with further comments.
Thank you,
Ms.
Mr.
Guzman.
Chairman. We did want to thank the sponsor and the dentist for allowing us to come with amendments. We did have some proposed amendments that we shared with them and you all ahead of time in order to make this bill a better piece of legislation. We still stand opposed to it, but we're trying in good faith to be at the table to make a cleaner bill. With that, Mr. Chairman, I'm happy to walk through those amendments if you would like. This is what the document looks like. It was sent to you email, and also have a printed copy. It's the black and white.
Why don't you go ahead and walk through them, and we just walk through the bill and walk through the amendments as you go, and you explain why the value of them, please.
Sure, Mr. Chairman. The first amendment we have would be on page 2, line 13. After performed, we'd have you insert if those services performed are accurately documented in the provider's clinical notes. Along with that amendment, both of these go to clarification, accurate documentation, so we tried to lump them where they were linked together in the bill. So then if you go to page 4, line 21, after code, you would insert, or when the claims documentation or clinical notes submitted do not align with the procedure billed. Mr. Chairman, the reason for this amendment is just to ensure that there is accurate documentation for the procedure that is performed to reflect the correct coding that has been charged. Otherwise, this language will result in claim denials and more out-of-pocket expense for the patient. So we just believe that this additional red language does clean up that wording a little bit.
Okay, questions on this amendment number 1? Amendment number 1 this is off the Delta Dental 2-pager. Questions from the committee? All right, just please proceed.
Thank you, Mr. Chairman. The second amendment, number 2, is in regard to bundling. So on page 2, line 17, after unless, we would delete through line 19, and that language is under generally accepted practice standards. The procedure code is for a procedure that may be provided in conjunction with another procedure. And after unless, we would strike all that language and then insert the additional procedure codes provided are considered a part of the more inclusive comprehensive procedure build. And then also on that, it links back to page 4 with the definitions, and we would delete billing and insert payment. The reason for this, again, is bundling is right now, as I understand it, kind of the current practice of how they do business. And anything that is unbundled are items that are typically not, that would not be charged separately. Some examples that I've been given are like Novocaine or PPE or follow-up warranty work. So we would just ask for those changes to, again, clean up that language.
Okay, very, very good. Any questions on that from the committee? This is amendment number 2. Please proceed to 3.
Mr. Chairman, amendment number 3 is just simply deleting or infer. We don't think that that's appropriate language to be in statute. All of us infer things differently. So we just ask that that be deleted.
Okay, thank you. Questions there? None? Next page.
Thank you, Mr. Chairman. Amendment number 4 is just a deleting of page 4, lines 1 through 5. We just think that this language in general interferes greatly with private contracts and would ask that that not be placed in statute at all.
Okay, questions on this one? Questions? Seeing none? Please. Senator Hutchings? Senator Hutchings?
How she feels about it.
Yeah,
Mr.
we'll get
Chairman.
Senator Jones back
Okay.
up here. We'll just go through these from these folks. All right, go to number 5, please.
Thank you, Mr. Chairman. Number 5 is an amendment, just to be sure that there is informed consent and financial responsibility, so the patient will know that they are going to have the extra costs. So on page 5, line 2, we would ask you to delete who has written informed consent of a patient, and instead, and then also delete on page 5, line 4, published in the dentist fee schedule. And then insert not to exceed the third-party payer's fee schedule as long as the patient has signed a written informed consent that identifies their specific financial responsibility for the procedure. Mr. Chairman, the reason for this is that we do just want to be sure that a patient is going to recognize and give their consent that they will be subject to an extra cost if that certain amount has been denied or is above the claim level.
Okay, so just to be clear, Ms. Wilkinson, this is 2 different options for that page 5 of lines 1 through 4. Is that accurate? One was delete it all. The second one is modify it. Is that accurate?
No, Mr. Chairman. So delete those 2, sorry, on page 5.
Oh, line 4, I'm sorry, page 4. My apologies. My apologies. My apologies. That's on me. All right, thank you. Questions on this one? Questions on this one? All right, thank you very much. Any further comments?
Thank you, Mr. Chairman. I would just turn it over very briefly to Ms. Guzman to, we do have a handout. We weren't sure if the committee would want to see it on just the costs that would be associated to this. I know you were short on time, so we can also hand this out, but we did have numbers of direct examples of how this bill would impact it. You also have a green sheet, just for your information, got the wrong green sheet, on correct coding that just explains this language and exactly what is done.
I have this one. Okay.
Yes.
All right. Ms. Guzman, if you'd like.
Mr. Chairman, thank you very much. On the document that Catherine has discussed, and I believe she has copies of for you, it basically just outlines some of the costs that would be associated for groups, individuals, and payers when, in the event that this bill had passed. So for example, when it comes to bundling and the ability for claims to not be billable to a patient, if that is passed, based on Delta Dental of Wyoming, I can only speak for Delta Dental of Wyoming, so based on Delta Dental of Wyoming's claims in 2024, if we were not able to bundle claims, we would see a cost increase of over $900,000 that would be shifted to patients. And in addition, the state of Wyoming is a client of ours, and so their claims, as Ms. Williams was discussing, we would see an increase, based on 2024 claims, we would see an increase in $320,000 that when claims were not bundled, if they were unbundled, that we would see that would be shifted to the state of Wyoming. Mr. Chairman, right below that, we do have some examples of the down coding, and I know we at Delta Dental of Wyoming call it correct coding because we're correcting it when it is incorrect. One of the main examples is surgical extractions, and we do have behind us, I have Dr. Ed Clark. He is a dental consultant that could speak a little bit more in detail on this. But on down coding, for example, you can see the surgical extraction submissions to Delta Dental of Wyoming in 2024. We had just under 6,000 claim submissions for a surgical extraction. And in 2024, Delta of Wyoming had to correct code just over 1,100 of those, which is 19.62% of all those claims. And the reason for the correct coding is because those claims were submitted stating that the provider did a surgical extraction, but when we reviewed the clinical notes did not indicate that a surgical extraction was completed. And so the clinical notes do not match what is actually being billed by the dental office. And one other example real quick, because I know we're short on time, Mr. Chairman, is the Crown submissions to Delta of Wyoming. We had just over 12,000 Crown submissions that were submitted in 2024. And we had to correct code for only 472 of those. And so that's only 3% of the Crown claims that were submitted to us had to be correct coded. And so, Mr. Chairman, this document just kind of gives you a few examples, and then on the back of it, it shows the information on balance billing. And balance billing is when the provider is able to, when Delta Dental has their amount that they reimburse on the claim, then if the provider is able to balance bill the difference between what the provider has billed the patient and what Delta Dental pays. And so if that was allowed, you would see that the amount here, just for Delta Dental's book of business with our customers in 2024, we would see an increase in $808,000. And specifically for the state of Wyoming, just over $500,000.
We've got a question on that, those last two numbers. The book of business, that does not include EGI.
Mr. Chairman, the book of business does include EGI in that. I just broke out the EGI so you would be able to see that as well. You're welcome.
One last comment that I wanted to make is that Delta Dental of Wyoming is a Wyoming nonprofit corporation. We don't have shareholders. And what revenues we do have, part of those revenues go back to our foundation to fund unfunded oral health care for seniors, low-income seniors. And the rest of it goes to support funding new plan designs and allowing us to expand our scope of business to offer affordable dental care throughout Wyoming. Thank you.
Mr. Chairman, same question as I had before for the other group was the way if the patients are going to pay it or you're going to pay it in insurance premiums one way or the other. Is that a correct statement from your point of view or not?
Mr. Chairman, yes. If we are not allowed to use their term down code, correct code, then that cost is shifted to the patient completely.
Thank you.
Thank you very much. Further questions? So on that, go ahead, Senator Hutchings.
Thank you, Mr. Chairman. Sir, you said the cost would be shifted. Do you have an idea? Shifted more, shifted less? If we pass it.
Go ahead, Mr. Hall, if you'd like.
Well, Mr. Chairman, if they have the ability to bill for those services, then they're going to be billing patients for those services.
Will it be less, Mr. Chairman?
More.
Okay. So to be clear, they have the ability to bill now. Your position is there would be potentially more of this billing done. Is that accurate? Go ahead.
Mr. Chairman, It depends upon the procedure. So if a procedure is a covered benefit, and it's right coded or down coded, correct coded to a procedure that matches the description of the services rendered, then they're held to the fee for that service that it's right coded to or correct coded to. With this legislation, they would be able to bill up to the procedure that they stated that they performed in the original claim. And so that would significantly increase the out-of-pocket costs for subscribers or their patients.
Okay, thank you. Further questions? Further questions? All right, thank you very much.
Thank you,
Appreciate
Mr. Chairman.
Thank you.
All right, anyone else want to testify to the bill? Go ahead, come on up. Anyone else wants to testify, Bill, you can come on up too. Two or three or whatever we need.
Good afternoon.
Guys, please proceed.
Senators. My name is Edward Clark. I live here in Cheyenne, Wyoming. I'm a licensed dentist in Wyoming since 1979, number 750. Oh, thank you. I am also a certified dental consultant through the American Association of Dental Consultants. And to get that, you have to be a practicing dentist for at least 5 years. You have to take some courses, pass an examination, attend regular annual meetings, extensive continuing education. As a dental consultant, I act as an advocate for the patient, for the purchaser of the plan, and also for dentists. First, though, I'm a dentist, and second, I'm a dental consultant. I still do volunteer work such as Give Children a Smile. Now, duties of a dental consultant. Sometimes I consult on lawsuits. Sometimes I answer phone calls from individual dentists and answer their insurance questions. 99% of my time is devoted to Delta. I'm an independent contractor hired by Delta to review their claims per the CDT, which is the law, the terms and policies of their contract. Now, I oppose Senate File 159. This would prevent corrective coding. Now, everybody keeps saying down coding. It's actually corrective coding. To submit a claim, there is a code, a descriptor, but certain conditions have to be met to qualify for a code. It might be 2 or 3 different conditions as outlined in CDT. Let's take, for example, surgical extractions that they were talking about before. There are extractions, there are surgical extractions. Surgical extraction, the criteria are it's necessary to remove bone or section the tooth to get it out. If it's not in the record that they did that, it's not a surgical extraction. If it's not in the notes, it doesn't exist. That's kind of an old medical legal term that you might hear. Today, I did consultation this morning before I came here. I saw at least 6 claims. People were being charged for surgical extractions. There was no mention of there being any removal of bone, sectioning of teeth, or the like. So again, I'm acting for an advocate for the patient and the plan purchaser. So say, for example, a retired state of Wyoming employee comes in to have a tooth out, and it's coded as a 7210, a surgical, no mention that bone was removed, no mention that the tooth was sectioned. It's just an extraction. Difference is a couple $100. So that retiree, instead of being billed for $200, now they're responsible for the bill. The insurance company's not responsible for the bill. Instead of being billed $200, they're being billed $400. I see that there are no mention of this being a surgical extraction, so I corrective code. I don't down code, I corrective code to a 7140. The patient then gets the benefit for an extraction. There's been talk about bundling. According to the CDT, the ADA, this is the law, when you do work on a tooth, say do a filling, it should include, generally includes anesthesia, the preparation, the isolation, bonding, bases, liners. I constantly see dentists submitting for what they call an indirect pulp cap. Now in that, this gets a little bit technical, a lot of decay, but they don't remove all the decay. They leave some decay over the nerve, then they put a medicament on top of it. According to ADA, that is an indirect pulp cap. But what we see happening, they keep saying they're doing indirect pulp caps. They're not leaving decay behind, which is criteria number 1. And ethically, they're not informing the patient. So if you have to leave decay behind, you should inform the patient there's still disease in that tooth. They're not doing that. So when I look at these claims and they say indirect pulp cap, but there's no mention that decay was left behind, no mention that they have informed the patient, then I deny the claim. It's not down-coded, it's part of the procedure, and they call that bundling. That's not bundling, they're unbundling. Another procedure we're starting to see quite a bit of is local anesthesia, getting the patient numb. Now, it's generally considered, according to the ADA, it's mentioned at least 7 times in here, that that local anesthesia is part of the procedure. I reviewed one claim, they're working on 3 teeth in a row, 3, 4, 5. They claimed block anesthesia in 3 different areas. Well, there's only 2 nerves that innervate this. The patient was charged extra for additional block anesthesia when it was already covered by the other 2. So again, not allowed. If we are not allowed to corrective code, and I've never been asked to do down coding. I've only been asked to do corrective coding. If I'm not allowed to do corrective coding, the patient is on the line for probably a more expensive procedure that they did not receive. There are plenty more examples, but I don't want to bore you with them. Buildups, crowns. But in general, I practiced for 42 years. I didn't have these problems, but I'm a geek. I read this. Delta also gives a manual to every dentist that they participate with that says when you do procedure A, you have to submit 1, 2, and 3. If they don't submit 1, 2, or 3, it's not a clean claim, and we can't adjudicate it. So we ask for more information. If you would read the manual and see what you're supposed to present, you wouldn't be constantly asking and answering all these questions. So again, I speak in opposition to this because it'll tie my hands. I will not be able to do corrective coding. Patients will be on the line for procedures that weren't actually performed. Questions?
Thank you, Mr. Clark. Any questions for Dr. Clark? Questions? All right, thank you very much.
Okay, thank you.
All right, anybody else in the room? Nobody else in the room? Anyone online? If you've already heard it, you don't need to repeat it. Anyone online?
First is Tiffany Monk.
All right, Ms. Monk?
Hello, can you hear me?
Yes, we can. Go ahead.
Can you see me?
Nope, but go ahead and proceed. We're
Okay.
running short on time.
All right, Mr. Chairman and members of the committee, thank you for the opportunity to present my views on this bill. My name is Tiffany Monk, and I'm located in Green River, Wyoming. I'm a Wyoming licensed insurance producer and consultant, and I assist employers in providing group benefits to their employees. I am also a member of the Association of Wyoming Insurance Agents, whose views are reflected in my comments today. I rise today to strongly urge this body to thoroughly investigate the full impact of SF 159 before moving forward with a vote. Our concern is that this bill carries the potential for serious financial consequences for consumers, seniors, families, and also critical state programs such as Medicaid and Kid Care Chip. A key concern of how this bill enables providers to potentially manipulate procedural charge codes, ultimately complicating the insurance transaction and confusing consumers. When dental services are broken into separate codes rather than being billed as a comprehensive service, it creates potential for loopholes where certain portions of treatment may end up not being covered, leading to unexpected and unaffordable charges for patients. This tactic is already a growing problem in the healthcare industry, where some medical providers play coding games that negatively impact consumers. A clear example of this occurs in the healthcare industry with the Affordable Care Act Wellness and Preventative Schedule. Under the ACA, annual physicals and cancer screenings are required to be covered by plans at no cost to the patient. However, some doctors are using coding loopholes to bill portions of these services separately under non-preventative codes, resulting in unexpected charges. A patient may go in for an annual wellness visit expecting full coverage, only later to receive a bill because the provider coded part of this visit as a separate evaluation or diagnostic service. This practice leads to consumer confusion, increased financial burdens, and reduced access to necessary care. Our concern is that if SF 159 is passed, the same pattern may unfold in dental care, and consumers will be misled into thinking certain services are covered, only to be hit with surprise bills due to fragmented coding practices. Before advancing this legislation, I would urge a comprehensive evaluation of dental costs and coding be conducted. Without this analysis, it is impossible to fully understand the long-term impact of this bill on access and affordability. Therefore, in its current form, I implore you to vote against SF 159. Thank you for your time, and I'm happy to stand for questions.
Thank you, Ms. Monk. Any questions for Ms. Monk? Seeing none, thank you very much. I see several other names on here. If you think you're in opposition, you've heard what your comments were, we'll stick with that. I see Mr. Hayes on here, Ralph Hayes, and Ms. Young, both opposition to this. If you think you've heard what you needed to hear, oh, there's Mr. Hayes. Welcome, Mr. Hayes. That looks like a retirement gig there, Mr. Hayes. Make it
Yes,
brief,
Mr.
please.
Chairman. My name is Ralph Hayes. I'm a retiree who has the dental coverage with the state of Wyoming. Yeah, I'm a little bit more casual dressed than my previous visitations with the committee. I'm basically wanted to speak this as a consumer of dental care within the state and as a member who has Delta dental coverage. And this bill concerns me because one of the reasons employers have this in place is there's a contractual arrangement between participating providers and with the insurance company. And this bill basically severs some of the portions of that to where balanced billing can now be done to the patients, resulting in absolute unanticipated costs because of the way the unbundling services have. Now, I've been in the business for a long time, since the 1980s, in the healthcare financing, 2/3 of it through the self-funded side of it. And most of it was bundled before. It was already one charge for a numerous set of procedures. Really, the trend has been more towards the unbundling to maximize income and revenue for medical providers and also dental providers. So this idea of rebundling it, it's more of trying to remain the way we used to be. And as the good doctor mentioned, it's already in the dental manual that this base charge includes a wide range of things. So for me, if I go to a dentist and I go to a participating dentist, I'm really concerned that if I don't sign a piece of paper for a participating provider and that paper says they won't treat me, basically, unless I sign it, and it says they can balance bill me, I could get surprise bills. So I don't see this as a consumer protection. I see this as actually distancing protections for the patients. So I stand for any questions.
Thank you. Thank you. Mr. Hayes, questions for Mr. Hayes? Continue and enjoy your retirement. I'm sorry we had to pull you out on this one.
It's absolutely something that's near and dear to my heart because I am a consumer of healthcare in Wyoming.
Thank you. Appreciate it. Anyone else online have their hand up? Go ahead. Let's make it very quick, Ms. Young, please.
Thank you, Mr. Chairman. We just wanted
Well, we
to-
can't hear you. There you go.
Thank you, Mr. Chairman. Melissa Young with the American Council of Life Insurers in Denver, Colorado. And we just wanted to reiterate our opposition. Our comments have already been stated. Thank you.
Thank you very much. Further comments in the room? Further comments in the room? Senator Jones, you want to bring us home here? You heard some amendments. What's your, obviously we've got some interests, or some opposing interests on this bill. You've heard some of that. You knew some of that when you came in. Give us any closing thoughts, and we're going to take action on this bill.
Mr. Chairman, I do believe that we could work with these amendments right now. They might need a little bit of tweaking, but right now they're agreeable.
Okay, thank you very much. Any questions for the senator? Any questions? Seeing none. All right, committee, what's your pleasure on 159? What was it? Was there something online?
There was one more person on. the
Oh, I
list.
didn't have anybody else on my list, sorry.
He testified at the previous bill too.
Well, I think Mr. Haskell was opposed, is that who's on there?
Yes.
Yeah, I think we're just gonna have to skip it. We don't have time. Sorry, Mr. Haskell. Opposed or for or opposed to Senate File 159, Mr. Haskell?
I'm for it.
For 159. Thank you very much. All right. He was a dentist out of Buffalo, I think, just for the committee. All right. Members, what's your pleasure? What's your pleasure? Is there a motion on the bill? Motion on the bill. So I'm a co-sponsor on this bill, but based on the look of my members, I don't think we're going to get it out of this committee, so I'm not going to make a motion and go through a vote on this. So I think, is there any comments on the bill? Senator Steinmetz.
Thank you, Mr. Chairman. While I agree with the premise of the bill, I think it needs a little more work for prime time and more time spent on it. If you wanted to hold it over and work it as one of the sponsors, I'd be glad to help with that, but I just feel like it's not quite ready yet.
Okay, further discussion, further discussion? All right, I don't see any. So lacking a motion, this bill will stay on the table. If somebody wants to bring a motion on it at another meeting, we have at least 4 more meetings. We could take it up at a separate time, but we will get, if somebody's going to do that, please get with me, the chairman, and with the sponsor of the bill. So with that, I'm going to make a suggestion to the parties. There may be some tensions and some conversations that could be had to maybe help alleviate this without the legislature being involved, which is generally preferable for all involved. So I would encourage that. The second thing I would say is if you believe you do want to go forward something legislatively, the interim topic of dental in a broader sense may be something to consider. So I appreciate everyone being here. Thank you for those who traveled. With that, 150, we have 2 bills that have moved forward, 167, 158. There'll be no action on 159 today. We are adjourned. Thank you very much.
Let me also tell the
Here,
150.
Senator Scott has some, this is the advice from decades of experience.
Let me also tell the proponents that I would have moved the amendment number 2 on the Delta dental list.
Okay, thank you very much. We are adjourned.